meeting is being recorded.
नमस्कार सगळ्यांना, वेलकम आजच्या सेशनमध्ये. तर आज आपले मुख्य पाहुणे आहेत प्रशांतजी. ते हार्ट हेल्थ बद्दल बोलणार आहेत. त्याच्या आधी नेहमीच्या आपल्या पद्धतीप्रमाणे आपण मेडिटेशननी सुरुवात करूयात. तर आत्ता पितृ पंधरवडा सुरू आहे. तर पितृ पंधरवड्याच्या या दिवसांमध्ये आपण आपल्या अँसेस्टरांच्या प्रती, आपल्या पितरांच्या प्रती ग्रॅटिट्यूड, आदर व्यक्त करत असतो. आपल्याला सगळ्यांनाच माहिती आहे की आपण आपल्या पुढल्या जनरेशनसाठी प्रचंड कष्ट, त्याग करत असतो. आणि असं जनरेशन आफ्टर जनरेशन प्रत्येक जनरेशननी त्याच्या पुढल्या जनरेशनसाठी खूप देण्याचा प्रयत्न केलेला असतो. आणि हा पितृ पंधरवडा असा आपल्या कॅलेंडरमध्ये, हिंदू कॅलेंडर प्रमाणे असे दिवस आहेत की जेव्हा त्या पिरियडमध्ये आपण पितरांच्या प्रती जर काही आदर, काही रिस्पेक्ट, ग्रॅटिट्यूड व्यक्त केला तर तो त्यांच्यापर्यंत जास्ती चांगला पोचतो. आणि आपल्याला आता सगळ्यांना माहिती आहे की एव्हरीवन हॅव सेट ऑफ क्रोमोझोम्स, 23 पेअर ऑफ क्रोमोझोम्स. आणि आता असंही दिसून येते की लास्ट 7 जनरेशन्सचे क्रोमोझोम्स आपल्या क्रोमोझोम्समध्ये विशेष प्रॉमिनंट असतात आणि एपिजेनेटिक्स प्रमाणे ते एक्सप्रेस होण्याची शक्यता जास्ती असते. आणि जरी आपले पूर्वज आता जे त्यांच्या देहामध्ये नाहीयेत, आपल्याकडे पुनर्जन्म मानलेला आहे, त्याच्यामुळे लाईफ आहे, डेथ आहे, परत लाईफ आहे, असं पुनर्जन्माचा कन्सेप्ट असतो. तर आता जे देहामध्ये नाही आहेत, जे अव्यक्तामध्ये गेलेले आहेत, ते जरी त्यांच्या जीन्समध्ये नसले तरी त्यांचा मनोमय कोश अजूनही त्याच्या गतीमध्ये आहे. आणि त्याच्यामुळे त्यांचे जीन्स त्यांच्या देहात नसले तरी आपल्या देहामध्ये काही प्रमाणात आहेत आणि एपिजेनेटिक्स प्रमाणे ते ऍक्टिव्हेट होऊ शकतात. तर हा एक खूप चांगला पिरियड आहे वेअर वी कॅन शो ग्रॅटिट्यूड टुवर्ड्स आवर अँसेस्टर. तर त्या दृष्टीने एक खूप चांगली प्रार्थना मराठीतून मला सापडली, तर ती आज आपण म्हणणार आहोत. आणि बेसिकली आपण मेडिटेशनमध्ये आपला अवेअरनेस डेव्हलप करत असतो. आपला अवेअरनेस डेव्हलप करताना काही क्वालिटीज आपण आपोआप डेव्हलप करत असतो की आपल्या मनामध्ये काय होतंय, आपल्या शरीरामध्ये इन टर्म्स ऑफ सेन्सेशन्स काय चाललंय. आणि ऍक्च्युअली थिंकिंग अबाउट इट किंवा काही त्याचा विचार करणं ऍक्च्युअली आपण फील करतो मेडिटेशनमध्ये. आणि फील करताना आपण जे आयडेंटिफिकेशन असतं टुवर्ड्स धिस बॉडी, टुवर्ड्स धिस माइंड, ते थोडं कमी कमी होत आपण ब्रॉड अवेअरनेसमध्ये रेस्ट करण्याचा प्रयत्न करतो. आणि तेव्हा क्युरिओसिटी, फर्स्ट क्वालिटी दॅट इज रिक्वायर्ड फॉर मेडिटेशन इज क्युरिओसिटी. तर आज आपण एक अगदी थोडक्यात 2-3 मिनिटात एक क्युरिओसिटी डेव्हलप करण्याचं एक टेक्निक आपण करूयात. आणि त्याच्यानंतर मी ती पूर्वजांप्रती ग्रॅटिट्यूड व्यक्त करण्यासाठी मी ती प्रार्थना म्हणेन, ती तुम्ही शांतपणे आपण सगळ्यांनी ऐकूयात. तर मेडिटेशनसाठी प्लीज सिट कम्फर्टेबली wherever you are. You can close your eyes or make your gaze soft, whatever is comfortable to you. And you can take 2-3 deep breaths to come inside your body. Feel your body. Relax your tummy area. Relax your shoulder area, your jaw area. Relax your eye area, eye muscles, eyeball, eyelids. And feel your entire body sitting. And just to develop quality of curiosity, you may ask a question to yourself. What is that make me understand that I am sitting? Means like instead of thinking about it, you can feel the touch of your seat with your chair or cushion. You can feel your hands on your laps. You can feel your erect back. And feel your entire body sitting. And as you feel your body sitting, you might notice that your body is breathing. Breathing in, breathing out. Breathing in, bringing in awareness. Breathing out, relaxing your body. And as you become aware of your breathing, you can ask another question: what are the sensations that gives me knowledge that I am breathing? So instead of thinking about it or having some ideas, you can feel expansion, contraction, rise in energy, relaxation happening with each breath in and with each breath out. Feel your body sitting, feel your body breathing. And as you are feeling your body breathing, there would be some thoughts that will come to your mind, some impulses that will arise in your mind. So can you witness them instead of acting or identifying yourself with those thoughts or impulses? Being aware of your thoughts, your emotions. Feeling your breathe in, breathe out. And you can open your eyes. And I would invite you to listen to this prayer as a gratitude towards our ancestors. पितृ अष्टक. जयांच्या कृपेने या कुळी जन्म झाला, पुढे वारसा हा सदा वाढविला. अशा नम्र स्मरतो त्या पितरांना, नमस्कार साष्टांग त्या पूर्वजांना. इथे मान सन्मान सारा मिळाला, पुढे मार्ग तो सदा दाखविला. कृपा हीच सारी केली तयांना, नमस्कार साष्टांग त्या पूर्वजांना. मिळो सद्गती मज पितरांना, विनंती हीच माझी त्रिदेवतांना. कृती कर्म माझ्या मिळो मोक्ष त्यांना, नमस्कार साष्टांग त्या पूर्वजांना. जोडून कर हे विनंती तयांना, अग्नी वरुण वायू आदी देवतांना. सदा सहाय्य देवोनी उद्धरी पितरांना, नमस्कार साष्टांग त्या पूर्वजांना. वसुरुद्र आदित्य स्वरूप पितरांना, सप्तगोत्रे एकोत्तर शतादी कुलांना. मुक्तिमार्ग द्यावा उद्धरुनी तयांना, नमस्कार साष्टांग त्या पूर्वजांना. करूनी सिद्धता भोजनांची तयांना, पक्वाने आवडीने बनवून नाना. सदा तृप्ती होवो जोडी करांना, नमस्कार साष्टांग त्या पूर्वजांना. मनोभावे पूजूनि तिला यवाने, विप्रास देऊनी दक्षिणा त्वरेने. आशीष द्या हो आम्हा सकलांना, नमस्कार साष्टांग त्या पूर्वजांना. सदा स्मृती राहो आपुलीच आम्हा, न्यून काही राहता माफी कराना. गोड मानून घ्यावे सेवा व्रतांना, नमस्कार साष्टांग त्या पूर्वजांना. And here we are finishing with our meditation, and I will request Sabnis Kaka to introduce our today's speaker. Thank you.
Namaskar, everyone. I'm very happy to introduce Prashant. Prashant is my brother's son-in-law, and at a very young age, he has had great achievements. He is the head of the department at the Mangeshkar Hospital in Pune. And overall, he has been a very bright student all throughout his career. And he's also very helpful to many people, whoever has any kind of issues, health related. And so I'm very proud of Prashant, and very happy to have him on our platform to talk about heart health. Many of us are seniors, but also there are some younger people. And so, Prashant, whatever you want to tell us and help us, so let us know. Thank you very much.
Thank you, Shrikant Kaka. It was nice that I joined about 10-15 minutes back, and I had a little opportunity to speak to everybody. And someone, the topic that was originally planned was heart health for seniors. And at least here in India, at least in the part of India that I live in, I sometimes get a feeling that the seniors actually have better heart health than some of the younger ones that we have. Some of the younger people that I see are, having angioplasties at age 35 and 37. And it clearly reflects that there is something wrong that is happening in the systems, something wrong in the lifestyles. It's not necessarily always about the medicines, but it's also something to do with the lifestyle. Um, uh, I would be sharing a slide. Share करू आता?
हो करा.
So for me, it's an evening time. Good evening and good morning to everybody there. Good morning. I am from Pune, and this is my hospital, Dinanath Mangeshkar Hospital. And we have our cardiology department somewhere on this floor. This second and third floor, this entire floor is ours. If you ever happen to be in Pune, and I see a lot of Marathi speaking people here, a lot of you would have extended family members here in Pune. We are in the heart of Pune city, and it's a fairly well-known hospital in the city. Over the next 30 minutes, I would just be covering more broadly about what a common person or someone with an educated background should know about heart health. It's intended primarily for seniors, but it applies to everybody, even the younger people. Heart disease remains the #1 killer worldwide. Now, today incidentally also happens to be the World Heart Day. And today I was looking at the prevalence of heart disease in India. In 1947, the life expectancy of a child born in India was only 32. So a child born in 1947 was expected to live around 32 years. But in 2024, that life expectancy has increased to around 76. So there's clearly doubling of life expectancy. The #1 cause of death in 1947 was infectious disease. In the mid 1940s, there was a revolution, and primarily in the form of antibiotic therapies and antimicrobial therapies. And infections to a great extent, particularly bacterial infections, went on the back burner, and people started living longer and longer. But it brought about a new problem. As people aged more, we got more people living with diabetes. The nutrition quality was supposed to improve, but it resulted in an epidemic or pandemic of obesity. And that added to our woes, and we started seeing more and more people suffering from heart disease. Today, as it stands, heart disease is the #1 killer worldwide. It is also the #1 killer in India. So it's gone are the days where Indian mortality was different and Western mortality is different. Now, heart disease currently worldwide is the #1 killer, and by a distance. The #2 is all cancers put together, and yet it is not even half the number that heart disease kills around the world. Also, incidentally, what happens is that heart disease is something that is greatly preventable. And even after you've had heart disease, if you make the rectified changes, rehabilitation from heart disease is also very gratifying. You can have virtually normal quality of life after suffering from a heart attack, undergoing an angioplasty and bypass. You would not be surprised there are people who are running half marathons and marathons after having a bypass surgery. So very few diseases in medical field which can be prevented, which can be treated beautifully with modern medicine, and which after that treatment, if we do the rehabilitation correctly, can place the person not just in a normal lifespan, but also great quality of life. So over the next half an hour, I'll just be elaborating on some fundamental things that we should be doing that would lower the burden of heart disease worldwide. So what's the heart? the heart's the pump of the body. It is the most hard, as cardiologist, I would naturally be biased to believe that it is the most hardworking muscle of our body. Even the brain gets to rest during sleep, but the heart unfortunately cannot say that, I need to stop when a person is sleeping. It will have to continue to function. It continues to pump about 4 to 5 liters of blood per minute, even during rest. That is when you are sleeping. And the main function is to supply nutrition and oxygen-rich blood to all parts of the body. But the heart itself, because it's pumping, requires its own nutrition. And that nutrition comes from these small blood vessels, which itself, they supply blood to the heart. And that is the fuel that the heart utilizes to continue functioning, and then in turn help the other organs of the body to get oxygen. Now, when we speak of a heart attack, we are primarily speaking of an entity called as atherosclerosis. And atherosclerosis is something that starts as soon as a person is born. People believe that heart disease is something that you see only once a person gets a heart attack. But actually, the process starts very much early. In fact, there are people who are now believing that heart disease starts in utero, that is, even before the child is born. Only a newborn child would have a perfectly pristinely clean arteries. Within the first decade of life, you would start seeing blockages developing in the heart, in the blood vessels. And all the blood vessels supplying the brain, blood vessels supplying to the kidneys, blood supply also to the heart. And these blockages start to increase in size. This is because of deposition of cholesterol and cholesterol-like things. Today we understand about cholesterol, but there are X number of things that we do not know about in medical science. And these things keep on accumulating in the blood vessels. And gradually over the next decade of life, you get what we call as fatty streak in the blood vessels. These become more, and the blood vessels become more and more narrow. And by the time around 4th decade, you start seeing established atherosclerosis in the blood vessels. So only a newborn child, if you cut open his artery, would he have a pristinely clean artery. Atherosclerosis is inevitable. It will happen to everybody because we are mortal beings, and it is going to happen just like there is going to be graying of hair, wrinkling of skin. Similarly, the vessels in our bodies age, and one marker of aging of our blood vessels is atherosclerosis. This is what I was speaking about. If you cut open the artery, cut it in a cross section, make it look circular. Inside the artery, you would see in the first decade of life small plaques. And as the person ages, these plaques become more and more prominent, and they compromise the cavity or the lumen of the blood vessel, limiting the blood supply that can be done through these blood vessels. Eventually, a crack opens up in these atherosclerotic plaque, and this crack attracts a blood clot, and that blood clot comes suddenly and occludes or completely obliterates the vessel and results in a heart attack. So this is how a heart disease progresses. As I was suggesting, that the heart itself requires its own blood supply. And if such a blockage comes into these tiny blood vessels, which are around 2 millimeters or 3 millimeters in size, if they get occluded because of that atherosclerotic plaque and the blood clot that is sitting on top of it, you get compromised blood supply to that portion of the heart. And if this compromised blood supply lasts for more than 15 to 20 minutes, that results in permanent damage to the heart muscle. And that is a heart attack. So this is how a heart attack comes about. Occlusion of the blood vessel that supplies blood to the heart muscle. If it lasts for more than 15 to 20 minutes, there is permanent damage to the heart, and that is a heart attack. This heart attack is currently a representative of the #1 killer worldwide. So how do we prevent it? Do we have, do we as human beings have the scientific know-how to completely prevent heart attacks? The answer is a mixed bag. Yes, in some instances we do, but in many instances we cannot. We cannot change the aging process. We are not immortals. God created human being as a linear, being who would be born, age into young adulthood, then elderly citizens, and then. But the process is continuous, and therefore age is a factor that I cannot modify. We as South Asians are somehow predisposed to heart disease, much more than what a Caucasian would be, or a person coming from Oriental background would be. And family history is something that we as currently with no access to genetic manipulations, we cannot change the family history of heart disease, and we now know that heart patients tend to cluster in certain families. But there are several things that we can change, and these things account for almost 60% of the heart risk. These are high cholesterol, smoking or tobacco habits, patients with high blood pressure, patients who have diabetes, patients who are obese or consume excessive amount of alcohol, but the greatest new pandemic, that is physical inactivity. And I'll elaborate a little on all of these. So age is the number one factor. I showed you how atherosclerosis comes about. Consistently, what we have understood is that it's only a newborn child who has pristine arteries, and aging is inevitable. We can slow it down with our good habits and good lifestyle measures, but we cannot prevent it entirely. We as human beings were to be born. Yes, the soul remains eternal, but the body does age, and it will age into a day when we get elderly. Our hair becomes white, our skin becomes wrinkled, and so do our arteries. They stiffen up and they get blocked by atherosclerotic plaques and blood clots. So this is something that we cannot completely modify. We also know that we as South Asians, and by South Asians I primarily represent, the representative population is primarily India. We now know that compared to every single ethnic group in the world, we tend to have a more aggressive heart disease. We tend to have heart disease about 10 to 15 years earlier than the other populations around the world. And somehow our blood vessels tend to be smaller and more prone to diabetes related damage and atherosclerosis. We also quite now know that our metabolisms in India make us prone to poor handling of fats and carbohydrate intake. And that predisposes us to what we today refer to as visceral adiposity. That is, we tend to not put fat around our cheeks and in our thighs, but around our tummies, which gives us a belly fat. And this belly fat is the one which is very metabolically active. It produces X number of hormones and other substances, which predisposes us to higher heart disease. Combined with the fact of rapid westernization or rapid consumption of more refined foods, the epidemic is spreading like anything. And environmental insults. There has been a sudden change in lifestyle. Sometimes it's good because it has brought about progress. It has alleviated poverty. It has alleviated starvation to a great extent. But it has also brought about a new problem of overnutrition, bad nutrition, malnutrition of the other kind, over intake, excessive intake of not very appropriate foods, and a pandemic of obesity. So this has predisposed we in South Asian phenotypes, as we refer to them as phenotypes, to a higher risk of heart disease. We also can't change, we have 23 chromosomes, but one particular pair of chromosomes different in men and women. Men tend to have higher incidence of heart disease, and women catch up, but after their menopause. So from some divine protection that they have, that the gods have created womankind in such a way that until they reach the stage of menopause, they tend to have lower incidence of heart disease and lower incidence of atherosclerosis in particular. But once they reach menopause, and in the elderly, therefore, they catch up with the same risk factors that men would have. And therefore, senior elderly women are not necessarily free from heart disease. We are more and more recognizing that women also have heart disease. Yes, in the younger age group, we have more and more men, but as women age, they too catch up. Women also tend to have not very typical symptoms. So you are not going to get the filmy heart attacks that Sriram Lagu had in his film. Many of women have very, atypical, not very typical symptoms. They might just complain of lightheadedness, some shortness of breath, some jaw discomfort while walking, or some plain lightheadedness or nauseating feeling. And unless we do an ECG, we would never be certain that that woman is not suffering from heart disease. So in women, there is a lower threshold for doctors also to order investigations, because symptoms can be very, very atypical or non-typical. And it is only very high index of suspicion that is required to identify these women who might be suffering from heart disease. The earlier you diagnose them, the better the outcomes in the long run. But a lot of things in medicine are preventable. And therefore, I wouldn't emphasize more on things that we cannot change, but there are a lot of things that we can change. This is a proverb from Czechoslovakia, and it's very, very useful. Wisdom is not exclusive to any particular, community. And this, it's a simple line, but it's very relevant. Misfortune will always come in by a door that has been left open for them. So we, as there are progresses, there is modernization, which has its own benefits, but it has led to some things which are making more and more younger people prone to heart disease. And while I agree that today's session is primarily directed towards heart disease prevention in the elderly, but when I see angiograms today, and we do a lot of angiograms, we are seeing younger and younger patients having vessels which should not be there. They're 35-year-olds. We do an angiogram, and their vessels actually look like 70-year-olds. And some 70-year-olds who have had fantastic lifestyles have absolutely pristine quality blood vessels. So there is something wrong in our systems, in our lifestyle, and we need to target that if we want to improve the community level heart health. And therefore, change we must. There are certain, if we do not change and we continue to make the same mistakes, we cannot expect that the results are going to be different. One has to make the changes to the adverse things that we have been doing in the past to obtain a new result which would be better. So the first comes cholesterol. And there are a lot of myths about cholesterol. You would get WhatsApp messages, Instagram messages, Facebook posts, which will be telling you that cholesterol is nothing. It's got nothing to do with heart disease. And these are entirely wrong. No cardiologist of any worth can ever say that. Nobody who has read the literature, who has gone through it, would tell you that cholesterol is innocent. Cholesterol is important. This is a fat which is floating around in blood, and too much of cholesterol floating in blood deposits in the blood vessels and keeps on building the plaque. And these plaques keep on accumulating over years to produce the problem. I showed you in the beginning that this process is a slow process, and this process needs to be arrested early. The problem is people who tell you that they have a blood cholesterol of 200 and see, I don't have heart disease. You don't have heart disease today, but I'm not looking at you today. I want to see you healthy 10 years down the line. And therefore, cholesterol needs to be treated today to keep the person free of heart disease or even risk of a paralytic attack about 10 years later. And there are two primary sources of cholesterol. One is through diet, and the other is the cholesterol that is made up in our body. And believe me, while there is a great degree of emphasis on diet, and yes, it is important, only 15% of blood cholesterol level is related to dietary cholesterol. 85% of cholesterol is programmed in our liver cells. And this probably also, makes we as South Asians or as Indians more prone to heart disease. Probably our metabolisms are tuned because of evolutionary manner not to assimilate or not to digest the modern nutrition in a way that would keep our cholesterol levels low. It's only 15% that comes through our diet, but 85% is programmed in our livers. And we now know that there are families who have very high cholesterol levels. And if we identify a particular patient with heart disease who has high cholesterol, I would urge them to get all their first family members, their children, their siblings, to get their cholesterol levels checked. And if they are elevated, then they should receive treatment at that stage itself, make the necessary lifestyle modifications and dietary changes at that stage itself before they themselves experience the heart problem. So it's important to identify these risk factors and treat them accordingly. Why is it so important? Because now again, we have unequivocal evidence, and this evidence comes from every part of the world. It is not an exclusive Western phenomenon. We have data coming from Japan, from China, from South Asia, from our own Indian studies, from Europe, from North America, and from South America. We now clearly know that cholesterol is directly responsible for heart disease, and lowering cholesterol reduces the risk of heart disease. So even 10% reduction in the blood cholesterol levels, not great, 10% of reduction in blood cholesterol reduction would produce a 20 to 30% decline in heart attacks. And this is a fantastic number. You could do something about it. And only if people check their blood levels for cholesterol and make the necessary changes to get the cholesterol levels low. A lot of emphasis and lot of industry, nutraceutical industry, focuses on what one must consume to get cholesterol levels down. What we know through science today is very, very clear As I told you, diet contributes only about 15% of our blood cholesterol levels, but those 15% are important because even 10% reduction will result in 30% reduction of heart disease. There are certain cholesterols which are no-no, they're absolutely evil, and those are the trans fats. Where do you find these trans fats? For those who are fairly aware of what we have in India, Vanaspati was very popular in our olden days. It's fortunately on its way out. Some of the bakery products which have shelf life, the only reason that they have a shelf life is because they have been made in Vanaspati or hydrogenated fats. These are the most dangerous form of cholesterol that can exist. They're extraordinarily atherogenic and produce elevated blood cholesterol levels and atherosclerosis. The other group of cholesterols are the saturated fat, and there is a degree of controversy around it. This is the fat that primarily comes from animal sources and also from vegetarian sources such as coconut oil or palm oil. They are bad and they're overall considered to be bad, but they're not as villainous as the trans fats. We also have some good cholesterol coming from monounsaturated fatty acids, primarily coming sourced from olive oil, groundnut oil, or sunflower oils, canola oil, mustard oil. Polyunsaturated fatty acids primarily come from soybean oil and sunflower oil. And then we have omega-3 fatty acids, which come primarily from fish sources. Now, the trick here is not in consuming one in excess of the others, but try and rotating the sources of oils. Oil is bad overall, but it is essential because some vitamins and some nutrients require oil to be absorbed. And if I'm so fixated and obsessed about heart health, I'd be doing more damage to brain health, nerve health, liver health, and kidney health. So you need all forms of nutrition for our body. And therefore, a good way to go about it is to mix oils, keep changing it, rotating the oils that we use in our daily cooking. Another major risk factor, and this unfortunately is increasing in India. In the past, smoking or tobacco consumption was primarily, young men or rural populations which would, take tobacco in forms or smoke BDs. More and more educated class is consuming cigarettes. Unfortunately, data that I have been informed, more and more young women have taken to smoking, which is not something that we were seeing 10 years ago. Smoking or nicotine consumption in any form is bad. It increases blood pressure. It reduces good cholesterol in our body. It damages arteries and blood vessels directly. It's not just heart disease. It is directly responsible for multiple cancers. And there are X number of, toxic compounds that tobacco smoke contains. So it's not just heart disease. Every organ in the body only gets harmed or, diseased because of consumption of nicotine. There are multiple ways by which one must encourage people to give up this habit. There are certain aids that help. We have nicotine chewing gums, nicotine patches, but at the end of the day, it is just behavioral. One must keep their mouth shut, not consume tobacco, not smoke through tobacco, and it takes intense willpower. It's not one of those, getting rid of a bad habit requires intense willpower. And people who are into meditation, people who emphasize yoga can help. If you know a friend who is smoking or tobacco, they themselves know it is wrong, but they do not have the willpower to give up. And here the social support of a group which is like-minded and supportive at that moment and encourages them to give up this bad habit will go a long way in reducing heart disease in the populations. So intense willpower, and there's nothing else that will help a person get rid of the tobacco habit. Another risk factor one must know of is hypertension, high blood pressure. So what is high blood pressure? High blood pressure is any value more than 140/90. And this high blood pressure is called as a silent killer because on its own, it does not kill. It is these high numbers which will predispose an individual to heart disease. It will predispose patients to renal failure. We clearly know that people with high blood pressure have 5 times higher likelihood of getting kidney failure. It produces patients to get peripheral arterial disease. Even people end up getting amputations done because they do not get blood supply to the limbs and the toes. Vision loss. People do not directly attribute high blood pressure with vision loss, but hypertensive retinopathy is a leading cause of blindness in the developing world. and number one cause for stroke or paralytic attacks. The amount of debility that paralysis can give, it's not just about lifespan improvement, it's also life quality improvement. Paralytic attacks and the kind of deterioration to life quality that it can cause is huge. The burden is enormous, not just for the patient, but also the other family members. And directly, if there is one direct relationship of paralytic attacks, it is with high blood pressure. And therefore, one must look for high blood pressure. Again, it is a silent big killer because it does not produce symptoms on its own. The only way to identify high blood pressure is going to the doctor and getting it checked. About 50 million people around the world are believed to be hypertensive, but only 1 in 3 do not even realize that they have high blood pressure. And the only reason is that they're not checking blood pressures. So the only way to find out whether you have high blood pressure or not is to visit the doctor, and every doctor's visit has to be accompanied by checking of blood pressure. Does treating this high blood pressure improve health? Yes, the answer is again yes. Identifying is one part of the problem, but treating it well is the other end of the solution. Just by lowering blood pressure below 130/80, we would reduce paralytic attacks worldwide by more than 35 to 40%. We would reduce heart attacks by 25%, and we would reduce heart failure by 50%. So just one risk factor being identified and treated properly would reduce the disease burden in the population by these dramatic numbers. And this would require everything. This would require diet modifications, weight optimization, exercise, but medications also play an important role. So I want to attribute everything to lifestyle modifications. Medications do play a role, but lifestyle modifications have an equally important role in the management of heart disease. Another risk factor, which everybody must be aware of, is diabetes. Again, we in India or in South Asia are today referred to as the diabetes capital of the world. Again, that is because maybe by evolutionary means, we had a metabolism which was skewed in a manner wherein we do not, large meal burdens or carbohydrate rich diet, our metabolism probably cannot adjust to it. And again, it is a silent killer to a great extent. Unless you check for blood sugar levels, one is not aware that they are diabetic or not. And it is not very uncommon to find a first visit to a doctor with a sugar of 500. So it's not very uncommon. But there are some subtle symptoms which are not directly attributable to diabetes. And there is a lot of misinformation even in society about diabetes. Even subtle symptoms such as increased thirst, slow healing of wounds, fatigue during their daily activities, blurring of vision, frequently requiring to going to the urinal, and unexpected weight loss may indicate that this could be diabetes. So these are very subtle symptoms, and the only way to identify diabetes in patients who are probably having these subtle symptoms would be to check their blood sugar levels. Once you have checked the blood sugar levels, you would know whether you are non-diabetic, and the reasons for these symptoms could be something entirely different. But at least rule out diabetes by a simple blood test, which can be now done even at home. So one must look for diabetes in patients who are predisposed to familial history of heart disease. And diabetes is not just a killer for the heart. As I told you, nobody dies of high blood sugar levels. They die because of the complications of high blood sugar levels. And those complications can cause kidney failure, they can cause vision loss in the form of retinopathy, they can cause nerve problems with tingling and numbness in the hands and feet, pain in our legs, inability to sleep because of restless legs in the night. And these are directly attributable to diabetes and poor control of diabetes. But also equally important is that diabetics are 5 times more likely to get heart disease. Equally important is the fact that people who have had diabetes for more than 5 to 10 years seldom have the classic or typical chest pain that comes with heart problems. They might have very subtle issues such as feeling lightheadedness, feeling unusually warm, or घाम सुटतोय मला, म्हणजे it is cold outside, people want to wear a sweater, they want to come indoors, but I am feeling suffocated and I am sweating. That is a feeling that a diabetic is likely to have when they are suffering from a heart attack, or symptoms that like angina, which are the warning symptoms of a heart attack. And therefore high index of suspicion is required when we look at a diabetic patients, and high index of suspicion therefore guides more investigations. So there are diabetics who sometimes criticize the doctors, why are you ordering so many tests? But it's for the patient's own good. If we can pick up the things early, we can treat better and we can prevent future complications. And the treatment goals are very simple. The main goal is do not try and overdo it. One must avoid low blood sugar levels, but one must also avoid very high blood sugar levels. And while achieving this, we have to look into the fact that the patient does not develop any complications such as ketoacidosis and electrolyte disturbances. So do not overdo it, but try and keep away from the complications of diabetes. Some numbers that everybody should be aware of. It should be everybody, even the common public, should know about. There is a test called as HbA1c, and this test is a screening test for diabetes. A normal person who is not diabetic has a value less than 5.8. Anyone who has a value more than 6.5, 6.5, I repeat, 6.5 is a diabetic. But when we treat a patient with diabetes, we want to target a level closer to 7. But in certain senior citizens or elderly patients or patients with frailty, we may choose to be more liberal in our diabetes control and aim for blood sugar levels in the range of 150 to 200, which often translates to an HbA1c of around 8. And every diabetic patient should be aware that in their case scenarios, we are being more liberal or more aggressive in treating it. So a 40-year-old diabetic, that is not very uncommon in India now, needs to have his HbA1c corrected to a level of 7. But a diabetic patient in his 7th or 8th decade of life, I may accept a glycemic control of keeping an HbA1c of close to around 7.5 or 8. So age and frailty matter when we manage diabetes. The aim is not to get into the complications of over-treating diabetes, but also prevent very high blood sugar levels. Another thing that is making its way, it started from the US, but it's also come, things have changed also in India. We are now seeing an epidemic of obesity in India. This obesity is the root cause of a lot of the new lifestyle diseases that we have: high cholesterol, diabetes, increased cancer risk, mood disorders, heart diseases, reproductive problems, liver diseases, and even high blood pressure levels. So obesity is a root cause. Improving, no, I won't call it improving, changing nutrition patterns even in India are resulting in more and more obesity in our country. And it's not uncommon to see such patients walking around on the streets of India. There were about 50-60 years ago, starvation was an issue. It still is, but so is overnutrition and malnutrition of a different kind that is becoming prevalent. Fueling it is modern lifestyle. It's starting in very, very early age groups. Children sitting on their sofa, munching on fast foods and not having any physical activity, not going out to play with friends, is fueling this epidemic of diabetes, of obesity, and of high blood pressure. And therefore, interventions do not necessarily need to happen at the senior citizen age group. Things need to change at an early age group so that I can prevent heart disease in the future. And therefore, these things need to start early. These changes that we need to bring about in society to prevent heart disease needs to start early so that they enter their senior citizenship or elderly age without heart disease. And therefore, the changes need to happen in an early age group. Why am I showing this slide? Those who are from my part of the country are very aware of these buses. This is from Mumbai. These are called as the best buses. In Pune, we call them the PMT buses. There was a study done in the 1950s and 60s in the US, and it has been reproduced here in India. There are two gentlemen who are fixated in these buses. One is a driver and one is a bus conductor. Both have similar work hours, similar amount of stress. The bus driver needs to work for about 12-14 hours shifts, driving from congested traffic in Pune or Mumbai. The bus conductor has to make his way around the aisle in the bus, haggling with the customers for the changes for the bus ticket. Both have similar amount of stress on surface, but they have different incidences of heart health. Same work hours, same salary structure, on surface looks like a similar job profile, but the people, bus drivers tend to have 2 to 3 times higher risk of heart disease as compared to bus conductors. And there is a reason for it. The bus driver keeps sitting throughout his duty hours, whereas the bus conductor is walking around in the aisle. And this continuous standing and moving about, while they have orthopedic issues, while they might have varicose veins, but they surprisingly have lesser heart disease as compared to bus drivers. And this clearly indicates that moving is important, and sedentary lifestyle is driving the pandemic of heart disease around the world. And therefore, it's important to keep on moving. Even if you have a desk job, make it a point that we get up once every 30 minutes, walk around in the room, probably drink a lot of water, go and have water, go to the washroom. But it's important to move, and movement will keep just moving, not sitting in one place, is going to help prevent heart disease. These bus conductors and bus drivers aren't necessarily the most educated population in the world, but even there, there is clear evidence that moving protects the bus conductor from heart disease, which his friend, the driver, has to go through at an earlier age as compared to the bus conductor. And how much exercise do we need? It's not much. It's very modest. You need only about 30 to 45 minutes on most days of the week. And it's not impractical. It's only 30 minutes of the 24 hours in a day that one needs to move. And simple exercises like walking can give you that benefit. And therefore, the dictum is, you don't require expensive gym equipment. You don't require a fancy t-shirt or a fancy track pant to do it. Just wear your chappal or your shoes and walk. Walking 30 to 45 minutes is what is needed to prevent heart disease. And the world is acknowledging it. It's not just Indian guidelines or the American College of Cardiology guidelines or the European Society of Cardiology guidelines. The World Heart Health Organization, the WHO, which looks over the heart health around the world, including Africa, Asia, South America, North America, Europe. There is clear evidence now that modest amount of exercises, only 150 minutes a day, 150 minutes a week, that amounts to about 30 minutes a day, protects a person from premature coronary artery disease, premature heart disease. And if you are interested in doing more intense exercises, you can even shorten that duration of having a badminton game, having a cricket match, having a short basketball, just jumping and some hoops. Even 75 minutes, that's approximately 15 minutes a day. That protects you from heart disease, premature heart disease. So it's very modest amount of exercise that is needed to improve heart health. And surprisingly, most people around the world are not even getting this much of exercise. Even exercise, there are a lot of misconceptions. When I spoke about exercise here, I spoke about moderate intensity exercise. And moderate intensity exercise primarily implies walking, swimming, cycling, going for a hike. Those are the kind of exercise that constitute aerobic activity. What are aerobic activities? These are activities that get your heart beating a little faster, make you sweat lightly, and this kind of activity should be around 30 minutes a day. In addition to this, we are now increasingly recognizing the importance of muscle strengthening activity. That does not mean you join a gym and pull up weights. Simple things like doing squats or doing yogasanas, doing Surya Namaskars, improve not just muscle memory and muscle health, but they also help in improving flexibility and improving balance. And why is balance important in elderly? Because we want to prevent falls in the elderly. So besides just moderate intensity walking, swimming, and cycling, a small degree of flexibility training and balance training is important to prevent future falls. A fall in the elderly age group can be, very damaging. It really hurts their quality of life, not just them, but also other family members, because one person down, another person has to look after him. So balance training, flexibility exercises, strength training, these are important. Then they cannot be, sidelined because we want to emphasize only aerobic activity. And in this, I find yoga extremely important. It not only helps, yoga is not just about the various asanas. It also, all these asanas also help the memory, the muscle memories. It helps balance. It also helps you calm down in the mind. It helps breathing. All these are important. And if there is one exercise that helps besides aerobic activity, it has to be this. Another important is stress. Now, stress is extraordinary because I told you of other things, high blood pressure, which has a number. I told you about diabetes, which has a number. I told you about cholesterol, which has a number. I even told you about exercise, which has a number. I told you about 150 minutes a week. But stress is something unusual. There are people who would not even have, high pulse rate when they're pushing the nuclear button. But there are people who would make a small thing, mothal bahu kartak. In Marathi, we call it, बाऊ करणे, छोट्या गोष्टीचं बाऊ करणे. And therefore stress cannot be quantified, and each individual is different, and therefore each individual will require a different way of approaching their own stress management strategies. Stress can come from workplace, apeksha, as we call it, as desire to have everything, and it comes in the workplace. Everybody ambition is driving modern stress in the workplace, but stress is also coming at a very young age. School going children in our populations, extraordinary stress that I see them, people joining tuition classes in 9th or 10th standard because they want to go to an IIT, that kind of pressure. I don't know whether it exists in America, but it's existing here, and I'm glad that more and more people are recognizing the kind of stress that children are going through here. But this stress starts at an early age, and this stress, it becomes a habit. These children are going to grow with that habit of taking stress for everything. And therefore, behavioral change needs to start at an early age so that they enter their elderly years or the senior citizenship in a healthy manner. And therefore, this prevention of heart disease starts at an early age. One can approach stress in multiple ways because the cause of stress in every individual is different. That stress needs to be individual. Stress management strategy needs to be individualized. It could be anything. It could be exercise, it could be spa, it could be joining a hobby, joining a yoga group, finding peace in nature. It could be anything. People who are gifted practice music and they feel good about it. People who do not have talent in music, someone like me, enjoy music. I'll enjoy listening to music because I cannot, but I enjoy listening to it and it helps me. Some people find joy or relaxation in cooking. Unfortunately, we in India have so many cuisines that it does not require, just putting all your mind into making the best chapati or the best bhaji today can relieve stress in some people. Even people, you do not require extraordinary resources to, relieve stress. Even people can, rangoli can be an art, and anybody can do it, and they find joy in it. They find relaxation in it, and that relaxation goes a long way in combating the stress and the pandemic of heart disease that stress is driving in the society. Some people find stress relief in going for a hike. Fortunately, I come from a part of India which has a lot of what we call as girds or forts. And we as a group, once in every 2-3 months, would like to visit a fort. It, from the dense population that we, or the societies that we are in, these hikes give us a break. Going into nature in a peer group, sharing ideas, sharing thoughts beside work with them. This helps. Some might find joy or relaxation in joining a family activity, like just potting a plant or working in a garden. This gives them joy. This makes them stress-free, and this helps. And this is one slide. It comes from Okinawa. It is most people of you here would be aware. It's one of the blue zones where you have a lot of people living healthy lifestyles, living past 90 years, many reaching 100 years in age. These communities have, on surface, appears to be what is perfect way of combating stress. They have everything in proportion. They have work in proportion. They have diet in proportion. They have exercise in proportion. But what binds them together is a social life. They meet very often, beyond work, beyond just family meetings, just to have fun, just to smile, just to sing, just to share a meal. And this kind of groupings or these kind of gatherings and socialization helps them combat stress. It keeps them healthy, free from diabetes, free from high blood pressure, free from heart disease, and allows them to live healthy, high quality lives into their 90s and even up to age 100. So we need to learn something from these senior people. We want to bring it into our systems, into our societies. We have a long way to go. Most of these changes are not very resource heavy, but it only needs a change in mindset. I end here. If there are people who would like to have some questions or would like to give even suggestions how we would like to bring about these changes in our societies, I'd be more than happy to listen to them.
Thank you so much, Dr. Mishra. It was really very informational session, and I'm sure people have lot of questions and comments. But thank you so much. This was very appropriate that this group will gain lot of information from. Uh, so one question is, what about BP new guidelines 135/85 or even lower?
These are the new BP guidelines, no doubt. For most patients, these guidelines are correct. Modern medicines, we are in the past, there was an entity, we used to call it essential hypertension. It was believed that as you become older, this high blood pressure is essential for the organs to get blood supply. We have changed, we have now recognized that high blood pressures, even 140/90, predisposes an individual to elevated risk of strokes and heart attacks. So this modern number of 130/80 has basis in science. There should be an effort to get to these numbers with reasonable means. Reasonable means meaning don't overdo it. As I said, common sense prevails. If possible, by reasonable means, try and get to these numbers with lifestyle interventions and drug therapies, because we now know that people who have blood pressures less than 130/80 have more complication-free lives long term and live longer. We now clearly know about that. But someone who has very brittle control of blood pressures, they would have a tendency to fall and hit their head, produce problems. Those are there. I would be more liberal and accept a blood pressure of 140/90 also. But for most patients, that number of 130/80 is really important. I wouldn't compromise.
Yes. Anaghatai has asked, what are the causes of cardiac arrest, especially at young age? Are there any indications or body giving messages?
I agree. I have a gut feeling a lot to do with our modern lifestyles and the way modern medicine is designed. It's believed that heart disease is especially a disease of the elderly. And believe me, when I started practicing around 2008, when we did an angioplasty of an individual less than 55, the whole hospital would know about it. Oh, we had a young patient, he had a heart attack, and we had to do an angioplasty, emergency angioplasty about it. Believe me, in my hospital, virtually every week, I now do an angioplasty in a sub 40-year-old. So, and this trend started pre-COVID. So there is something wrong in our lifestyle. Something is wrong. And I, while this talk was supposed to address to seniors, why I changed, I requested Shrikant Kaka to change it, because I'm seeing younger and younger patients. And I believe the root cause starts early. And it's not just limited to the elderly. This heart disease problem is happening at an early age. These patients tend to ignore, there is a degree of, are me young, I am young, I can't have heart disease. So they don't get themselves investigated. They do not believe themselves that they can ever be susceptible to heart disease. Heart disease is a problem of the elderly. I am never going to have a heart attack. 50% of patients who come to the emergency room with a heart attack first come in denial that this cannot happen to me. So that clearly indicates that the message should go even at a younger age, that this could happen to you, and start acting on it now if you want to enter your senior citizen years without heart disease. So I deviated from the topic primarily for this reason, that this change needs to happen early. And believe me, we see angiograms of some 60-year-olds which are better than the angiograms of some 40-year-olds. So some things that senior people are getting it right and the younger ones are doing it wrong.
So basically the same things that we are looking for in seniors, we should be looking for in younger people also, for symptoms or indications that somebody might have a heart problem or a BP problem. There are a lot of people joining even from Pune, and they're asking for your contact information. So if you feel comfortable, you can write in the chat if you are ready to share any sort of information so they can connect with you. Another question is homemade ghee better? Can homemade ghee be used or avoided?
Ghee fans are going to find me, they're going to be upset with my answer. Ghee is very good. Not all fat is bad. Everything has to be in proportions. So, for someone who has absolutely normal cholesterol, um, his body metabolism can digest that ghee appropriately. And ghee allows absorption of multiple vitamins and other nutrients, which are also essential for multiple other body organs. So one answer cannot fulfill every, but someone with a high cholesterol level, ghee is pure cholesterol, and his cholesterol is only going to get higher. So too much of a good thing is also bad. So proportions matter. So even too much of a good thing can be bad. Too much of exercise can also be detrimental to the heart. So we now know that marathoners need not necessarily always have great coronary heart health. They can have their own problems. We now know if that were the case, every Olympian or Olympic marathoner would be living till 100. It doesn't happen so. Are you getting it? So everything in proportions, and every individual is different. If your body is designed, if your metabolism is designed to digest ghee well without causing elevation of high cholesterol in your blood, then it's okay with you. But for others, maybe half a chammach of ghee, half chamcha of ghee in a day is a reasonable ration to manage that. That's how it is.
Yeah.
So diabetic, there are people who have 3 vatis of Shrikhand and they don't get diabetes. But there are poor people who have been disciplined all their lives and they have diabetes. And then they complain, how did I get diabetes? That is because their bodies are designed with that metabolism. And we have to acknowledge this is nature. Some things humankind cannot control.
Yeah, so we cannot generalize that one thing goes for everybody.
Yes, it cannot be.
Another question Priyanka asks, is statin necessary to take for cholesterol?
If you can get beautiful cholesterol levels with lifestyle modifications, why would you require a statin? But the thing, as I told you, there are people, and it is individual metabolisms. Our bodies are designed in particular manner. Maybe this high cholesterol levels had an evolutionary advantage 500 years ago when infectious disease were killing people. But in modern times, we are living past 70, most of us, and high cholesterol exposure for multiple years results in coronary artery disease. We now know that. And that same evolutionary advantage that probably high cholesterol had in the earlier eras or earlier centuries becomes counterproductive in this century. And therefore, if lifestyle modifications that includes diet and exercise cannot get your cholesterol to the desired level, then we must go to medication. And statins are the most proven medications. Have statins improved heart health worldwide? The answer is unequivocally yes. They are making people live longer and longer and with better and better quality of life. And it's an unpopular answer in people who are statin skeptics, but that is the truth. We are seeing that same experience, and it's not just in one population group. We are seeing in every race or every ethnicity. We are seeing it coming from Japan. We are seeing it coming from South Asia. We are seeing the same information coming from Europe, from independent people who have done independent studies. So, there comes a point where statin skeptics go overboard. If it is required for a particular individual, it is useful. Please check with your doctor if you require a statin. And if it is really required to get your cholesterols to normal levels or to the desired levels in that individual, it should be taken. But if you can get it with only pure lifestyle, why take a statin? Why take a statin?
There are individual questions related to specific symptoms, like what happens if there's heart palpitations, or, in young people, especially arm pain and things like that. Then another question is, can low BP lower than normal, be also a problem?
Again, each individual is different. This 120/80 number is a population number. There are people who are perfectly fine with a blood pressure of 90/60. You would not find it very uncommon to have a young college-going girl with a blood pressure of 90/60, and she goes to her college every day. She goes jogging. She does her college work. So it's not for that individual. Her body, 90/60 is perfectly okay. Such people, even if you know the baseline blood pressure, And such a person might develop a headache even if their blood pressure rises to 130/85. So that could be high blood pressure in their body.
Yeah.
Are you getting it? So
Yeah.
each individual is different. When we talk of these numbers, now these numbers tend to make us look a little rigid. We have to acknowledge the fact that each individual is a little different. And 90/60 in a perfectly normal walking, talking person is normal.
Yeah. So basically, each person by now knows their health and how it works. So if you fall in that category, then this is something to keep in mind. And as Dr. Mishra said, that it will be very, depending on each individual, it will vary a little bit. So it's not one size fits all, basically.
Yes, exactly.
So the individual questions that people have posted, so I think that answers the question for them that, A, consult with your doctor, B, take into consideration your health history, whether it has to do with heart, diabetes, blood pressure, and things like that. One question is, can you comment on LDL and lipid protein, and do we need to check it routinely?
Yes. Yes. I did see one or two very relevant questions there about LDL cholesterol. Very few things in medical science are certain, and this cholesterol thing is. The original study, how cholesterol was identified, there was this lot of East European or Russian scientists don't get credit for the lot of work that they had done. There were rabbits who were fed their regular food and rabbits who were given high fat food. And those rabbits who were fed the high fat diet and had high cholesterol levels in their blood developed atherosclerosis faster. That was the first experimental evidence that we had 100 years back. Gradually, we realized that there is a linear association, a clear line association. Higher the LDL cholesterol, that is a bad cholesterol, higher the incidence of atherosclerosis and higher the incidence of heart disease. So there is a clear association. And therefore, X number of efforts should be made in lowering LDL cholesterol. Unfortunately, what has happened in the last 10-15 years, in mythological stories also, if there is a bad thing, there has to be a good thing. And popular culture brought about that there is a, if there is a bad cholesterol, there has to be a good cholesterol. If at all there is a cholesterol that is an inert cholesterol, that is HDL, it is inert, it is not necessarily good. It is inert and it is again greatly genetically programmed. But LDL cholesterol is the real villain. And we should start at an early age in trying to keep the LDL cholesterol as normal as is possible. If it requires lifestyle changes, dietary changes, if it requires medications, it should be taken. There are people who complain of aches and pains. It's not very uncommon to get aches and pains with statin. And I saw a question there. Fortunately, in 2024, if you are suffering from that issue, please speak to your doctor. The doctor today has multiple other options besides statins also, which are extraordinarily well tolerated, do not cause aches and pains, and which are designed to get LDL cholesterol lower without statins. So each individual is different. Some do not have any symptoms with statins. They can continue taking statins. But even if you have some negative side effects with statin, speak to your doctor. They have options today, extraordinarily safe medications that can get the LDL cholesterol lower without causing those muscle pains. So speak to your doctor about it. But don't stop taking your medicines on your own. Please don't stop your medicines on your own. That's the biggest fear a doctor can have, stopping their BP medications and statins on their own.
So every time before we start any session where we have an expert talk about especially medical issues, we always put a disclaimer. So today we forgot. So I would like to reiterate what Doctor just said, that don't stop or start any medications before consulting your own individual physician for safety. Okay, we have a couple of questions. So Sampada Shahani, do you want to unmute and ask your question?
Thank you for the opportunity to ask the question. My question is like, suppose you are found with you need to start the statins and high BP medication, but later on, if it is getting controlled, once you start acting on your lifestyle, exercises, and other factors, with, of course, the doctor's consultation, can those medicines, like both high BP and statins, be lowered and eventually be gotten rid of or stopped?
Seldom are they stopped abruptly. we would withdraw rather than stop suddenly. So yeah, it is the right thing to do. Why take a medicine if you don't require it? But I'm always worried about people. Oh, my blood pressure now is 120/80, but I was taking 4 pills for controlling my blood pressure. So don't stop all of them. Speak to your doctor. Chances are that they would reduce 1 tablet at a time. They wouldn't like your blood pressure or your cholesterol to go uncontrolled suddenly. For about cholesterol, it rarely happens, that very high cholesterol levels that have been treated with medicines, the medicine completely goes away. You will get normal numbers, but those normal numbers are based upon how these medicines work. These medicines basically work on your own metabolism. They help your metabolism get rid of that cholesterol in a more efficient manner. So statins work on the liver, make it more efficient in getting rid of the bad cholesterol from the body. So speak to your doctor. Generally, they would not abruptly stop your medications. They would withdraw it slowly, 1 tablet at a time, or lower the doses and see on regular follow-up visit whether they can entirely remove the medication. But has it happened in the past? Yes. We have had patients who, because of extraordinary lifestyle modifications that they have done, they have gotten rid of their medications. It does happen, but it takes intense discipline. I hope there are people here who have that intensity and discipline to get rid of their medicines if they would like to. Yeah.
Yeah.
Thank you. Thank you so much.
Yeah. And we have another question from Ajit Natu. Please ask your question.
Namaskar. Thanks for giving me chance to ask questions. Last week only we had a session here, this forum only, where the person had a stage 4 cancer and it was almost giving up kind of situation. And he actually kind of didn't opt for any medication, anything. He went through the lifestyle change, as in diet, proper diet, exercise, and he got cured. And he's actually preaching that, hey, these medicines and all those, they have a lot of side effects. Don't need to opt for it. You do regular lifestyle changes. So a common person like me, I think we are getting a lot of information overload. We hear one way and we hear other way. So where is the means? How do we go about? Who do we trust, doctor?
As I told you, you can notice how people who are in this field are extraordinarily careful in using words. As I spoke, each individual is different. I do not know about that particular patient's case, but please do not, have a family doctor. There are a lot of WhatsApp forwards, Facebook forwards, and there is people write anything. You need not trust everything. I understand there is an information overload, misinformation overload. Forget information, it's misinformation overload. If you really find something like this, rather than directly doing it on your own, trying it on your own or on your loved one, speak to your doctor, who should be also be a confidant, someone you trust, before you take any rash decision. It's, if it were so true, there would have never been a need for any branch like medicine. It's been there for eternity. And there is something right that modern medicine is doing. I told you in 1947, our life expectancy was 32. It is 75 plus even in India now. So in 2024, of a newborn child in 2024. So clearly something right is happening in modern medicine. It's not always villainous. An individual patient may have had a bad experience or some odd experience. Now, I can't comment for him. I do not know his case scenario. But before you take any medical decision for yourself or your family member, speak to a confidant, speak to a doctor who is your confidant. Verify your case, whether it fits those same details, and then only go about taking a decision. Take an informed decision, but not a decision because of emotional value. Who would like to take medicine? Believe me, even I don't like to take a medicine. Why would anyone like to take a bitter pill? We take it because it's needed. Are you getting it? Nobody would take medicine voluntarily. They are taking medicine because it's needed for them at that moment of time, at that point of time. So I hope that message does not prompt people to stop believing in medicine, stop taking their own medicines.
No. I actually believe in medicine. Absolutely. I just was
I'm
putting
just,
a case.
no,
Our problem is getting a true advice. It's no more like in India where you used to have family doctor
doctors.
in a true meaning of family who knows our family for 50 years. Today I went to Kaiser and they clearly say that if you stop medicine, then your health issues is no more our responsibility. If you stop medicines and do lifestyle changes only. So I understand. I was just asking a question. That's all.
It's also a problem that is coming to us. Even we are getting a very specialized practice. I am a specialist. The family doctor concept is slowly vanishing. It's an unfortunate development in medicine, but a confidant is confident. And we are getting more. Most medicine is also becoming ultra defensive. He was speaking of most ultra defensive medicine. We are not responsible if you do this. The family doctor had the right to take a decision in the good faith and with good intentions. That somehow, I agree, it's disappearing.
Yeah.
But still try and find.
Thank you for your nice lecture. We learned a lot. Thank you.
Yeah,
I hope it was useful.
yeah, we did. So one thing, all of us who are in United States, who are insured and have been here for a long time, one thing to remember is there are primary care physicians, okay? And that's closest to we can get to that family doctor concept in India. So make sure you visit your family care physician. You have one, first of all, and that is your whatever 6-month or annual visit where you get all these numbers checked and ask all these questions and get answers. So definitely there's no again, there's no one answer and there's no one way to approach this, but you can definitely consult with your doctor and make sure that you have a balance of medication and lifestyle changes so that it's not just one or the other. So thank you so much.
Okay, thank you.
So we are almost to the time. Before we end our session, again, thank you so much, Dr. Mishra. You took time out of your schedule and it's later in the evening for you in Pune, but you joined us and gave this fabulous lecture, and we have it recorded and it will be put on our YouTube channel, and we will send a link through our WhatsApp group. Also, Dr. Mishra, if it is okay, we like to add the speaker to our WhatsApp group for a day and open the group up if people have more questions or comments and if you want to chat with them. But it's totally up to you if you have time. Sabnis Kaka, do you want to say something before we end for today?
No, thank you very much, Prashant. This was really very helpful, and I know you personally. But it was really very refreshing and kind of very important information for all of us. And thank you very much.
Yeah,
I hope it was useful. I hope it was useful. I was trying to relate to whether the realities here are matching realities that you face there in the US now. We are also facing a pandemic here of heart disease. Let's see.
So yeah. Though wherever we go in the world, I think all Indians, our lifestyles and our habits are the same. So I think the similar problems are faced by people here as well. So thank you. Next time we are going to have an open session, and this is for everybody, all our enthusiastic members. So if you are currently reading or have read a book related to either meditation, self-care, yoga, or anything to do with the topics that we discuss in this group, and if you would like to share information about that book with us, we are going to have 7 to 10 people share a name of the book and a little bit about that book. Next time we are having that open session. So please connect with either me or Anjali, Alka, or Anagatai and let us know. So we will put your name on the list. And we look forward to hearing about different interesting book options that people are reading. So thank you so much. And I'm going to stop the recording. We still have 5 minutes if people want to just socialize.